Fantastic. So welcome. My name is Michael Rouse. I am really excited to be with you tonight to have our third webinar. Tonight is about back to school prep, tips for a healthier start to your child's school year. And tonight we've got two fantastic experts from the great folks of the Nemours Children's Health. We are blessed to have two fantastic doctors who will be speaking tonight about the important tips and suggestions that will help your children be the best versions of themselves during the school year. Just a couple things about tonight's session. You can see us, but we cannot see you. You're on mute, but please use the Q&A box to answer any questions that you may have tonight, because we will be trying to answer as many questions as we can that time allows. If for any reason we're not able to get to everyone's questions, we will be we will absolutely be working very hard to answer those questions over the course of the next session. And we'll also send out a recap in our recordings tonight, which will be emailed to everyone, which will also perhaps have some of those answers to your questions that we weren't able to get to. So let's talk about our amazing panelists. Dr. Maria Conley, she's a pediatrician at Nemours Children's Hospital. She's based out of Radnor. Dr. Zach Radcliff, he's a psychologist. He's been with us on our most recent webinar, who gave us some incredible tips about the summer and how to incorporate some great routines into summer and also transitioning into that new setting. Just first about each one of our panelists. Dr. Conley is a board certified pediatrician who joined Nemours Children's Health in Radnor in 2022 after completing her residency at Nemours Children's Health in Delaware. She's got some great interests when it comes to developmental pediatrics, family education, public health, and preventative medicine. She really strives to provide her patient families with relevant anticipatory guidance so they're really equipped with the knowledge and the skills to keep their children healthy and safe. Welcome, Dr. Conley. And Dr. Zach Radcliff, as many of you know, he is a pediatric clinical psychologist, works in the integrated primary care at Nemours Children's Health in Delaware. He's very passionate about equitable access in mental health services, telehealth, and supporting healthcare workers across many disciplines. He has a great focus in various areas, as you learned before, from everything from eating disorders to medical conditions to autism to LGBTQ. The list goes on. And he's been a former camp counselor, camp psychologist for various summer camps in the past 20 years, and he's an avid fan of the beach and garden and obviously with his family as well. So welcome, and thank you both for being here tonight. My name is Michael Rouse. I've got 4 children that are in this age range, a soon-to-be 4-year-old, a 7-year-old, a 9-year-old, and a 10-year-old. And we fell in love with Nemours about 2.5 years ago when our daughter was this was right before COVID, and we had some health challenges going on with my little girl. And so we spent the better part of a few months at Nemours, and we were absolutely taken by the incredible care and staff and support that and medical experts that were able to surround themselves around my little girl to really help figure out what was going on. And she does have some challenges, but we are always super grateful for the expertise we get from Nemours, and we couldn't be happier to be partners with them and to do these knowledge-based webinars to help our ESF families. So tonight's topic is back to school tips, and we are super excited to get it started. So let's begin.
All right. Thank you for that nice introduction, Michael. So I am just going to get on started. So it's really important that you visit your pediatrician. You know, when your kid is 0 to 3 years of age, you're seeing a lot of them. But once they turn 3, they should still be seeing their pediatrician annually. We know these visits are important, even if it's not a year that they don't have their recommended vaccines, because we still need to make sure that they're growing and developing well, that they have healthy weights, that their blood pressures look good, that they have normal vision and hearing screens, no signs of scoliosis, which is especially important during those years of rapid growth and puberty, and then that there are no abnormal findings during their physical exams. It's also a great opportunity to discuss any behavioral concerns that you might have, mood concerns, or poor school performance as well. It's also important to make sure that our children have all of their necessary vaccinations. So we did have some lapse in preventative care during COVID, and there are still some kids that were catching up on their school required vaccines. So by having your yearly physical, we as providers can make sure that your child's all caught up. From newborns to college students, we know that getting vaccinated can help protect your kids and teens as they grow into adulthood. And these on-time vaccines are really important to get these kids before they're exposed to highly contagious and life-threatening diseases, such as measles, which we did have a recent case in Chester County, whooping cough, and even chickenpox too. One of the newer vaccines is one that can prevent cancer. I'm sure all of you have heard of it by now. It's the HPV vaccine. And HPV is a common virus that is spread through intimate skin-to-skin contact. It can lead to certain types of cancers later in life. So it's really important to make sure your preteens get 2 doses of the HPV vaccine. Studies have shown that the earlier you get it, the more robust of an immune response you get. So the earlier you get it, the better for sure. Also, we want to make sure that we're keeping our asthma or allergy action plans up to date. So if your kids have asthma or specific food allergies, bee allergies, anything like that, you want to make sure that you get an up-to-date allergy and asthma action plan from your pediatrician. You want to make sure that your medications like the EpiPens, asthma, the albuterol inhalers are up to date, and that you provide all of this to the school nurses. It's also important that you call your PCP with any concerns. Don't wait until their annual well check or until after the school year ends to bring your child into the office. Really, we know that the earlier that we can see your child and address these issues, the better outcomes we end up having. All right, so we know that having a healthy lifestyle contributes to more success in the classroom. First off, starting with sleep. So a good night's sleep is necessary to do well and stay focused in school. You should aim to have a consistent bedtime each night. It's important to make sure that all electronic devices are off at least 30 minutes prior to expected bedtime. Most kids need 8 to 10 hours of sleep at night, and those younger preschool and school-age children should be getting close to 10 to 12 hours. If your child has trouble falling asleep, aim to turn screens off an hour before bedtime. Try to stick to a consistent bedtime routine, whether that's like bathroom, brush teeth, read a book. You can try some mindfulness activities too. And then try to keep the sleep space really cool, dark, and quiet. If your child's afraid of the dark, warmer red tone nightlights are less awakening, so try to stick to those. And then if you're really being consistent with your routines and still having problems, bring them into the pediatrician because there's more things to talk about then. We know diet is very important in keeping your child healthy. Studies show that kids focus better when they've eaten breakfast before school. So even if your child's not a morning person, not a big fan of breakfast, it's super rushed, try to find something, even if it's a granola bar, or you can add some Carnation Good Start into a glass of milk and send them on their way. It's really will help them. Kids should aim to get 3 meals a day and 2 healthy snacks as well. And then another important thing that we're not the best at is drinking water. So especially late school age children, high school children who are athletes should be aiming to drink lots and lots of water. Really, the minimum should be 64 fluid ounces a day. And if you have any concerns about their diet or anything like this is another thing to come in and see your PCP about. Exercise. Exercise is also super important to help support a healthy child. You should aim for 1 hour of physical activity a day. And it doesn't have to be structured. If your child isn't a big fan of sports, it's hard to get them involved in those sorts of activities, then just find a way to get them moving. So go on a family walk each night. But really, kids who exercise have better physical and mental health overall. So this is a goal to strive for. Screen time. So screen time is one of those difficult ones to try to limit the amount for our kids, especially our teenagers. But really, you need to become a little bit more strict in the school year, especially when it starts to impact sleep and school performance. So kids and teens ideally are getting less than 2 hours per day of recreational screen time. Older teens and adults, 2 to 4 hours, but really no more than 4 hours. And you really should be monitoring what kids are looking at and who they're talking to on their devices too. I always say whoever pays the bill should be able to check and see what's going on that phone. Make sure to set boundaries and time limits to not allow these to get in the way of school either. And then for sleep, I always recommend charging devices in parents' bedrooms just so they're less of a temptation for kids to go on overnight. And we know on those rainy days when you're stuck indoors, screen time, and it's summertime too, right? There's more hours in the day and you're spending more time on your screens, but just try to enforce having a break every 2 hours to get outside, read a book, do something to break it up. And then lastly, setting daily routines can be super helpful. We know consistent routines can help keep kids alert and productive during the school year, and it can be a lifesaver when it comes to avoiding problems, especially at bedtime. So routines can include consistent after school activities, homework schedules, downtime, dinner schedules, and then having a good winding down bedtime routine as well. All right. So we know open communication with children promotes healthy relationships and builds trust. It's important to work on this all year long, but there are specific things that you can try to focus on during the school year. So, first of all, really try to get involved in your child's education. Meet the teachers early on, reach out to them as soon as you start to identify any struggles or if overall performance is slipping. And then reach out to your pediatrician if you have concerns about potential behavior concerns or learning disabilities, because they can be a great resource to kind of figure out where to go next to get help with this. Make sure to set expectations about when homework needs to be completed. Schedule ample homework time for homework to get done. Create a quiet homework space can also be helpful. TV and other electronics should be off during homework time. And then if you can, try to set time to help your child review their homework or study with them at the end of the day if that's needed. One-on-one time. So this is important, even if it's a few minutes, a couple of times a week, it can be a good way to build a trusting relationship with your child. Car rides home from school or practice can be a great opportunity. And especially for our preteens and teenagers, take this time to have these important conversations now because it really will prove beneficial in the long run. Try to talk openly about friendships, puberty, sex, the dangers of drugs, alcohol, and vaping. Vaping especially, it's everywhere right now. And even in our middle school age children, we're starting to hear of kids doing it. So it's never too soon to start talking about these topics and always encouraging them to come to you as well with these questions. And, if there's anything that you have trouble talking about too, your well child visit can be a great opportunity to kind of get these conversations started. Next, watch for bullying. So if you're seeing behavioral changes in your child, if you have any questions, any worries about that, go to the teachers, alert school officials, and then you can go into your pediatrician and talk about that for some support as well. And then next, plan safe travel to and from school. So just kind of to go over the basics. If you're traveling to school in a car, starting from youngest age, babies who are rear facing in their car seat, keep them rear faced until they're maxed out on the car seat manufacturer's listed height or weight for rear facing. We see a lot of small children being flipped forward too soon, and it's just the outcomes are much better and everything is much safer when they're rear facing until they max out on the height or weight listed. And then once your child is big enough to flip forward in a 5-point harness car seat, make sure that they stay in that car seat until they max out on the height or weight based on what the manufacturer lists. And then once they get into a booster seat, keep them in that until they're big enough. Basically, they max out on that and they can fit in a seat belt. And just so you know, the lap belt for kids, it should go across the upper thighs, not the belly. And the shoulder belt should go across the shoulder and the chest, not the neck or the face. Make sure to buckle up at any age. And then this one's always a point of contention when the teenagers come in, but kids should stay in the back seat until they're 13. We just know that their musculoskeletal systems, they're still developing, and it just makes them so much more vulnerable to serious injuries if you are in a car crash. If your kids are walking to school, remind them to cross at crosswalks, utilize the crossing guards, always look both ways before stepping into the street. And that's really for the younger children. And then if they are taking the school bus, remind them to wait for the bus to stop to approach it, and also that they should stay seated until the bus stops completely before they get up to leave. You should make sure that you have good before and after school childcare for your child. So during early and middle childhood, children do need supervision. There should be a responsible adult who's available to get them ready and off to school in the morning and after school when they get home. If a family member will care for your child, make sure that everything's kind of consistent across the board. Set some rules in terms of schedules, discipline, and homework, just so that everyone's on the same page and it doesn't end up causing problems. When your children are approaching adolescence, if they're 11 and 12, they still really shouldn't come home to an empty house unless they're super mature for their age. So try to arrange some sort of childcare for them. And then lastly, having a good emergency plan in place is always good. So for your younger kids who are just starting off getting into kindergarten, first grade, they should know your full names at this point. They should have their home address memorized. They should have at least one parent's phone number memorized as well. And then make sure that all the emergency contact information is up to date at school. All right, illness prevention. So it's coming, that season, the sixth season again, kids back in school, the germs will be spreading. We know germs are everywhere. So hand washing with soap and water, it's still one of the best ways to remove germs, avoid getting sick, and preventing the spread of colds, flu, and other illnesses. So remind your kids to wash their hands before eating. That's a big one, and I think that doesn't happen a lot. So if it's possible to give them one of the little hand sanitizers they can keep on them, that will be really helpful in preventing the spread of illness. After they use the bathroom, that's another one that sometimes needs to be reminded for our younger ones. And then after blowing their nose, coughing, or sneezing as well. We became awesome with hand hygiene during COVID when it was peaking, but we need to remember to continue being diligent about washing our hands, especially as we're going into flu season. A big issue, especially for the little ones, preschool age children and younger, is touching their faces, putting things in their mouth, putting hands in their mouth. So just try to stop these habits as early as you can. When you see this happening at home, just step in, remind them not to do it. Try to find a creative way to talk about germs. In my house, we talk about yucky invisible bugs that you don't want to put in your mouth because they can make you sick. So just keep being repetition, and hopefully this can help minimize some of those behaviors that can end up getting them sicker more often. And then also teach your children to cough or sneeze into a tissue or the corner of their arm. If they do sneeze into their hand, just have them wash their hands, use hand sanitizer afterwards. And then another big one is just, if your child does become sick, we keep them home. We know that children learn best when they are healthy. They really shouldn't go back to school until they're fever-free for a full 24 hours and their symptoms are resolving. So,
Dr. Conley, as we go into the next slide, I know that we have seen a spike across, most schools in, you're hearing the word COVID again.
yes.
Very, very minimal throughout the summer, but now, late August and now the month of September, we're seeing that population of people, calling out sick children, teachers. Could you talk a little bit more about what's going on right now, and should we be concerned?
Yeah, absolutely. My next slide's going to touch on that. Do you want me to
Sure,
go
absolutely.
through that part first, and then we can kind of,
Yeah.
all right, perfect. Yeah, so that's exactly what I'm going to be going into now, the flu, COVID-19, and RSV. So last year that coined the term the triple-demic. And we're hoping, like Michael said, that this doesn't occur again, but we know that cases with COVID are already on the rise again. Not as many people are testing, but the way that they track cases now is through the wastewater surveillance. And by looking at that, you can see the viral load of COVID upticking right now. So we know that's coming. We haven't seen any cases of flu yet, but last year we had cases as early as October. So it's coming. And so hopefully I can give you some tips to keep you better informed and prepared as these seasons approach. So flu, I think at this point, everyone knows flu. We have flu outbreaks each year. It's a highly contagious respiratory illness. It's caused by either flu A or flu B. And it's still too soon to predict how severe this season will be. We know that in the 2022-2023 season, it began earlier than had been expected. And like I said, at Nemours, we had cases in early October last year. So the other thing about the flu season last year is there was a high burden of disease in children, and including high rates of hospitalization as well. And during the 2022-2023 season, there were 160 deaths reported in children, reported up through this July. And 41 of those deaths occurred in children who were younger than 5 years. Half of them were in children who had been previously healthy, and 90% were in children who were not fully vaccinated. So that's a really important point there. We know that children who are younger than 5 years old, especially those who are younger than 2, and children and adolescents who have underlying medical conditions, they're at the highest risk of developing these severe complications. And that could include things like pneumonia, sepsis, organ failure, just really bad things. So we really want you to get your child vaccinated as soon as possible. We know flu vaccines have been around forever now. They're safe. They're an effective way to prevent those serious symptoms, hospitalizations, and death due to flu-related illnesses. The other important thing to remember is that it takes a week or two to be fully protected from the vaccine. So, I got my vaccine today. You shouldn't hesitate. Everywhere, all your offices should have them at this point. So schedule those appointments and get your kids in to get those vaccines. The American Academy of Pediatrics does recommend the annual flu vaccine for all children without medical contraindications who are 6 months of age and older. And really, it's for children who are 8 years and younger. They're the kids, if they're getting it for the first time, who will need the first vaccine, and then 4 weeks later, part 2 of that. There's also the intranasal option. So if your kid has a severe phobia of needles, if they're in the age group of 2 or older, and they don't have severe asthma, they haven't had any wheezing issues in the past 12 months, then they could get that option. So that is a good thing to think about if it's very, very hard to get your child into the office to get their flu vaccine. And just a couple things. We hear this time and time again that, I got the flu vaccine last year and then I got the flu afterwards. And this is not possible. You can't get the flu from the vaccine. It's an inactivated virus that can't transmit infection. If you got sick after getting the vaccine, this was from another type of virus that you would have felt sick with, even if you didn't get the flu vaccine. So just keep that in mind. And then another misconception that we hear often is that people think that they're immune from getting the flu because they've never gotten it before. We'll hear, oh, well, I don't have to get the flu vaccine. We don't get that. And it's really rolling the dice, because we know everyone's susceptible to getting it. You've just lucked out in the past. And it is important to make sure that you're vaccinated. And then you can still definitely get the flu if you get the vaccine, but we know that you are much, much, much less likely to get those serious symptoms, including hospitalization and death. So flu, and now on to COVID. So there was some COVID stuff in the news, which I'll touch on at the end of the slide, but just, we talked about cases are definitely on the rise again. We know that the federal public health emergency declaration was canceled, but this definitely doesn't mean the virus is gone. And the best defense still remains getting vaccinated and really continuing the good health and hygiene practices like hand washing, staying home if you're sick, avoiding contact with people who have a suspected or confirmed COVID-19. I think a big question we continue to get is, do I really need to vaccinate my child? And we know that most unvaccinated kids will be just fine if they end up getting COVID, as I'm sure some of you have already witnessed. But there are still those rare cases where healthy children have gotten COVID and required hospitalization. There have been some deaths. There's been 1,500 deaths in children less than 18 since this all started. And then tens of thousands of children have been hospitalized. And this is why the AAP continues to recommend the vaccine for all children who are 6 months of age and older. And then just in terms of what you probably saw in the news yesterday with this new booster, though technically it's not called a booster because it's just going to be replacing the latest COVID vaccine that exists. But Pfizer and Moderna developed one that now has protection against the Omicron subvariant XBB.1.5. And the FDA approved it this week, and the CDC met yesterday, and they approved it for everyone 6 months of age and older. And so I heard that some places were already offering the vaccine today. Nemours doesn't have it yet, but it's basically going to replace all the current vaccines right now. So then this new updated vaccine will protect against the original strain, the 2 Omicron variants, the BA ones, and now the new Omicron variant, which is the XBB one.
Dr. Conley,
Yes.
is the COVID strain getting weaker or stronger?
Yeah, that's a good question. So we know that it is definitely less virulent from when it first came out. And so I think that's part of the reason and the question that so many parents ask, do we have to continue to get our kids vaccinated, especially if they've already had vaccines? And I think this is something we're going to have to continue to look to the CDC and the AAP for guidance about. But I think the most important thing is that those high risk groups are getting their updated vaccines. So that would be anyone who's 75 years of age and older, pregnant women, and then anyone who's immunocompromised.
Great. Thank you.
Yes, of course. All right. And then last but not least, RSV. So each year, respiratory syncytial virus or RSV, it infects lots of young children and also senior citizens as well. And it's the leading cause of hospitalization for kids who are less than 5. And for most healthy people, RSV is just a typical cold, run of the mill, congestion, runny nose, fever, aches, but it can be life threatening for the very young. And what ends up happening is it infects deep in the lungs. It can cause severe pneumonias. It can inflame the tiny airways of babies and lead to difficulty with breathing. So in the US alone, we have anywhere between 60,000 and 80,000 children younger than 5 who are hospitalized each year, and between 100 and 300 children will die from this as well. RSV spreads similar to flu and COVID through the respiratory droplets when people cough or sneeze. So if you touch a surface also where the droplets have been, if somebody had sneezed there, and then touch your face, you could get infected. So same thing, wash your hands with soap and water, use sanitizers. It's really important to practice hand hygiene to help prevent the spread of RSV. Um, if your child has been diagnosed with RSV, chances are they'll do fine. But certain things to look out for as a parent would be any difficulty with breathing. So one thing we always say to look for is retractions, which is basically sucking in at the rib cage when your child's breathing. If you see any sucking in the neck area here, if they have nasal flaring, if they have head bobbing when they're breathing, anything that looks like they're using their body to help them breathe would be a reason to definitely not hesitate and call your pediatrician. If they're turning blue around the lips, if they have high fever that's not responding to Tylenol or Motrin, if they're not drinking as well as they had been and are starting to have dry lips or tongue, or a decrease in the wet diapers, that would be a reason to call your pediatrician right away. There's been some good news recently about RSV prevention. For our little ones, there is a new monoclonal antibody for RSV, and the shot's different in that it uses antibodies to help protect patients from RSV for the entire respiratory season. So this one lasts up to 6 months. There was a previous RSV vaccine for premature babies and babies who had congenital heart problems, other immunocompromised states, but that only lasted a month long. And so they would have to come in for their monthly injections all throughout the RSV season. But this is awesome. One shot, it'll last the whole RSV season. And studies show that the risk of being hospitalized after getting the vaccine was reduced by 80%, which is amazing. So we'll wait to see when that will be available. We continue to look to the CDC for updates there. And then there's also in May, the FDA approved an RSV vaccine called Arexvy, and that's for individuals who are 60 years and older. And this shot greatly reduced the risk of developing severe RSV. It also reduced the spread as well. So this could be important for grandparents who will be spending time with new babies. One of the ways that they can prevent the spread would be for those grandparents to consider getting that vaccine, not only for their own health, but also for the health of the new babies and younger children that they would be around. And then the last RSV vaccine that's in the news now is called Abrysvo, and that was approved by the FDA in August. And that's for women who are between 32 and 36 weeks pregnant. And that not only is meant to prevent pregnant women who are considered to be in an immunocompromised state, but also their newborns as well. And that should really provide some protection for them in the first few months of life. So we're still waiting on some more information about that, but definitely keep, if you are pregnant, talk to your OBGYN about this vaccine.
Doctor, thank you. We have 3 questions that have just come in. Mind taking a shot at them. This is a 2-parter. Part 1, are there any signs or symptoms of common childhood illnesses or infections I should watch out for during the school year? at part two, is it okay to give aspirin or some type of medication that counteracts it, and then for my child to still go to school?
That's a great question. So part one, I think there are so many different types of viruses. There's stomach viruses, there's cold viruses, there's flu. And so really any change that you're seeing in your child, I would start to pay attention to. If you're noticing a decrease in their appetite, they're saying that they're having body aches, chills. And then of course, if they start to feel warm, I would start checking to monitor their temperature. Um, when in doubt, I would keep them home so that you can monitor them. But if not, just, if you have to send them off to school, they're fever free, of course, and they don't have any overt symptoms yet, then just make sure to be ready to get that call from the nurse too, because we know the symptoms can show up pretty quickly.
And when
Um,
you say fever free prior to medication.
Yes, exactly. Yep. No medication. Yes. And fever is 100.4. So it sounds pretty low grade, but fever, the definition is 100.4 degrees Fahrenheit and greater. So, yeah, for sure. And then the second part of that, in terms of medications to give, yeah. So, any sign of fever, you shouldn't be having to give them medication to get that temperature down. And if they're spiking fever without medicine, they should be staying home, because we know that when you're febrile, when you still have a fever, you're at the highest risk of transmitting the infection still, and you're just not going to get better. You need to be home, you need to be resting, sleeping more. Parents should be watching you to make sure that you're drinking lots of fluid, and that kind of surveillance can't happen at school. And like I said in the very beginning, you just can't learn as well when you're not feeling well. So, yeah.
Thank you. Next question is, are there any growth and developmental milestones parents should monitor as their children progress through the school year?
Through the school year. So I think that's a really good question. So for every child, every year, I mean, in babies less than one, it goes by, month by month, where we're looking for milestones. But yes, there definitely should be certain milestones that kids are meeting based on their age. In terms of kind of school, your teacher should be providing you with kind of an overall syllabus or kind of idea into what the expectations are for the school year. That usually happens in back to school night. They kind of give you the overview of what we're hoping to accomplish, at least for the first half of the year. And those appointments and going to them and, reaching out to your teachers if you feel like your child is really struggling, that's super important. In terms of kind of health milestones, I think that's something, there aren't specific things to look for, but I think it would depend on your age. And that's why seeing your pediatrician annually is so important, because that's where we're checking in on everything. That's where we're making sure they're growing those 2 inches each year. They're having adequate weight gains, growing along their curves, because every child's different. And so there isn't a generalization that we really can make across the board. But by seeing your pediatrician and making sure that we're ensuring that everything's happening and they're growing and developing well, I think that's the most important thing to do.
Great, thank you. Next question is, how can I best communicate with the school nurse and my children's teachers to ensure that my child's health needs are met while at school?
That's a great question. And we have that question a lot, specifically with kids who have special needs or special medicines that they need to take. And so that's another thing. And I know I keep going back to this, but talking to your pediatrician about, just because time and time again, we will write notes. I'll call and talk to a school nurse if it's something that's a little bit more complicated in terms of medical care, things to look out for. Like we'll have patients who come in who had like a high blood pressure screening, and we know that there can be that kind of white coat phenomenon where kids might just have this elevated blood pressure in the office. And then that's when we rely on the school nurses. We call them and we ask them to have the kids come into their office to check them there. So there's definitely a relationship that pediatricians have with our local school nurses. So I think start there, and we can provide the letters and have that open communication to help you feel comfortable with sending your kid to school, and knowing that they're going to be well taken care of.
Great, thank you, Doctor. Dr. Radcliff, welcome back. You're back by popular demand. We have several questions that have actually been sent to us during this presentation. I don't know if you want to jump right into it, or would you like to do an intro?
Yeah, I mean, wow, Dr. Conley has hit on so many great things, and I want to like reinforce that. And as you're like thinking about some of these questions, I think the slides that she presented are a wealth of great information, and certainly when I'm thinking about this time period for kids, and we have two munchkins ourselves in our household. One is a preschooler and one is in first grade, and we are thinking about adjustment and routines and sleep and just some of those basics, really trying to emphasize that. And so sometimes it is the basics, even though it doesn't always feel basic. But we came into this school year with reward systems around bedtime and around getting ready in the morning, because our first grader has ADHD, and so we've really kind of emphasized that to try and help things go as smoothly as possible. Now that doesn't always happen, and even as a child psychologist, my own child can get the best of me at times. So I think so many things that have already been highlighted are so important. Sleep routines, really important for kids, whether it's preventing and helping them recover from kind of physical illnesses, whether it's just helping them be mentally ready and rested. We know that like a lot of kind of transitioning the stuff they've learned during the day to long-term memory happens when they're sleeping. And so sleep is so important, and so important to emphasize. And we've got red lights in both of our kids' bedrooms that helps them kind of feel good about that. We use a light system that turns green when it's time to wake up, so it's red all night, turns green in the morning, so it helps them with that routine, because our preschooler can't quite tell time yet, but she knows when the light is red, you stay in bed. And so I think emphasizing some of that can be really helpful. And again, reward systems are great. It's not like you're going to be rewarding your child for like brushing their teeth until they're like 50, right? This is not something that you're going to have to do for forever. It's kind of targeting the things that you want to work on, and adjusting and tweaking. And the biggest challenge with reward systems is being consistent as parents. But yes, I know that there were some questions that came in, around some things beforehand too, about some different stuff. But so I don't know, Michael, if you have ones that you wanted to highlight, or yeah.
We can kick them off. So we've gotten a common theme, and that is, are there strategies or resources available to help children adapt to changes in the school environment, such as transitioning to a new grade or school? I mean, we're like 2 weeks into it. And I know parents, the common question was, this is a big one.
Yeah, and this is something actually we've been working with schools on and talking to them about. Nemours actually has a program. We're connected to some of the local school districts, and something that a lot of schools are starting to do, certainly at least in the Delaware Valley, is doing a lot more of the like pre-school year events, getting kids comfortable with the building, getting a chance to meet your teacher beforehand, and things like that. So those are great. Obviously, that has kind of passed us by at this moment. And so then it's thinking about, how do you help adjust? How do you help your child, hey, their best friend is in a different class, or they don't get to see some of their friends, in high school as much. They're at a different lunch, or they're in, different classes. And so how do you adjust to that? And how do you adjust to those teachers? And, you're still kind of feeling them out. We've got an introverted first grader who is, a little bit more reserved and a little bit more shy. And so there's a number of things that you can be kind of thinking about and supporting. So one, as Dr. Conley highlighted, that one-on-one time with your children is so helpful. And Michael, I know, you've got 4 kiddos at home. And so one-on-one time can be really challenging, and it can be really hard to find. There's some really cool research that shows that one-on-one time for 5 minutes 3 times a week has significant benefit, with like behavior, with parent family or parent child and family cohesion and communication. So it's not like you need to sit for an hour every day with each child, but really can be kind of just giving them undivided attention. And that means like your phone is away, their phone is away, the screens are off, you may be doing an activity together, you may be riding in the car. Wednesday nights are actually often the night that I have with our first grader. Younger sister goes to dance class, and so we spend some time together, and we actually were spending time together tonight before this, and they were cranky that I was then jumping on this actually, and so I had a little bit of a tantrum to deal with, and whatnot. And so that one-on-one time though is really valuable, right? Like he was mad that I was going to stop the one-on-one time early tonight, and so I think some of that can be so key, because you're going to hear from them about the things that are important to them. They're going to talk to you about the school day. They're going to kind of have a chance to de-stress. And so again, it doesn't have to be a ton of time. So that one-on-one time, definitely helpful. I think also connecting with teachers. So we already are in communication with our child's teachers. Our school district, school district wide, uses an app called Remind. A lot of schools have really started to use apps and do that. Our school district actually lets us have access to all of our child's teachers. So all the specials teachers, the school nurse, 2 administrators, are all available through that app for us to message. And so we can communicate with the school nurse. So we do have an asthma action plan. And so we made sure that that got, from our pediatrician to the school nurse, and we were able to communicate with them. Our kiddo is sometimes a little impulsive in class, and so we've already been working with teachers around strategies to help them feel like they are able to kind of stay engaged with the learning, and so they're doing some extra things, some simple different strategies, and we're problem solving with the teachers through the app, and communicating with them that way. And so I think some of those things go a long way. It also actually allows us to reinforce through reward systems. So he can earn, part of his tickets and prizes and stuff for how things go at school. And our teachers are letting us know how that goes. So that communication piece is really helpful. Staying in contact, even when you've got kiddos in high school and stuff like that, it's okay to still be in touch with their teachers. It's okay to still be kind of understanding and talking, to, whoever might be involved in their life. If they're having a lot of difficulties, reach out to the school guidance counselor as well. They can be excellent resources. A lot of schools are now contracting with like local therapy practices. Again, like Nemours is contracted with a number of school districts around our area. And so we have psychologists and therapists and folks in the schools that can be providing support and are running groups for kids and are doing different things to help kids get adjusted in. And especially those kiddos, again, I've got this shy introverted kiddo, and as an extrovert, that's been a challenge for me. But we work with the school around that too, of like, hey, they have a like social skills kind of lunch group thing that they can connect kids to and help kids who are maybe having a little bit of trouble have a quieter space and get a chance to kind of connect with only a few kids instead of the kind of the large cafeteria or within their classroom. And so giving them a little bit of space to do that. So open communication all around is one of the most effective things. And again, I'm going to sound like a broken record probably a couple times tonight, but I love the reward system. It's really powerful. We use do I even have them right here? I do. We use carnival tickets, and I'm a huge fan of the carnival. Oh, they're green, so they blend into my background here. But we use the carnival tickets, as a really great way. And both of our kiddos have bought into it, and they earn their tickets, and then they trade those in for prizes. And it doesn't have to be different, like specific money things. Sometimes it's screen time. Sometimes it's getting to go to breakfast with one of the parents, or getting one for our kids as they love a chance to like go with Nana to, the ice cream shop. And so that's a really simple, easy thing. It also gives us a break too. And they go with Nana to the ice cream store by themselves. And they traded in, 15 tickets for that prize. So there's lots of, simple ways that you can be rewarding kids and supporting them. And again, extra screen time, especially for younger kiddos where you're maybe more able to control the screen time, extra screen time can be a really powerful motivator. I know, I think also I'm seeing a bunch of questions about screen time too. So
Can I ask another question about the reward system? We're big fans of it in the Rouse house as well. However, I remember having a discussion with the head of school a couple years ago because he said a phrase, tricks for treats. Tricks for treats being like, what you do with your dog or your cat or things like that. Now, is there a fine line between, helping your children earn that routine of getting ready, getting responsible? Should we feel guilty at all when it's like they're getting a ticket for, getting ready for school? Like where do you draw the line?
It's a great question. And what I often talk to families about is like, where are the challenging times? So for us, one of our kids, the challenging time is morning, and one of our kids, it's bedtime. And so they can earn more tickets at that time for themselves. So our older one earns way more tickets in the morning, or has the opportunity to earn more tickets in the morning, because that is the challenging time. And so they earn tickets for all the different parts of getting ready. The younger one loves to get up and get ready and pick out outfits and do all of that. And we don't have to do as much with that. But at bedtime, that when the light is red, stay in bed, they're not always buying into that. And so they can earn their tickets then. And so we really kind of focus on those specific areas.
Underperforming areas is where you want to focus in on.
Yes, exactly. And I think there's a difference between a bribe and a reward. And I think that's the other thing for parents to understand. A bribe is when you're giving somebody a ticket to stop a behavior, or right. So your child's having a tantrum and you're saying, I'll give you 5 tickets if you stop. That's a bribe. That's not ideal. If you are establishing before the situation occurs that you can earn this. And I often say, if you're using language like if then, so if you do this, then you earn that. That's a reward, and that's reinforcing. And that actually, we know neurologically, that's going to get built into their brain, and they're going to get that. And so our first grader last year, we had trouble in the morning. By the end of the school year, they were only earning 1 or 2 tickets a day in the morning. They didn't need them. We had dialed back the reward system. Now over summer, we got away from some of that, and life was different. And so as we are adjusting back into the school year, we had to ramp up the reward system again in the morning. But I very much expect that we'll be able to taper that off again and maybe focus on other areas. And so, you got to kind of be flexible and problem solve. And if you're running into troubles with this, that's why people like me exist. And we're always happy to work with families around some of these types of things, and kind of problem solving and kind of figuring out ways to help kind of manage some of these things. Fall is definitely a busy time for us.
Thank you for clarifying that. That's fantastic. So moving into another series of questions, what signs should we as parents look for to determine if a child is experiencing emotional or behavioral challenges related to school where they're not really sharing that at home?
Yeah, and I think Dr. Conley nailed this one. I was kind of nodding along as I was hearing her talk about, if you're noticing changes, right? So if things are different, if you're seeing that they're changing their eating habits or their sleep habits, are significantly, kind of different all of a sudden, whether it's more or less. If you're seeing a lot of irritability, irritability for kids can be a sign of depression. It can be a sign of low self-esteem or being bullied, things along those lines. We also see that, sometimes showing up for kids who maybe have undiagnosed ADHD and have been kind of struggling to manage their attention and focus and are flying under the radar. We know that, girls often are, diagnosed later because they kind of fly under the radar, as well as kids who are anxious and have ADHD. And so we start to see actually at this time of year, though, that there's kind of this change in behavior, change in how they're kind of acting. And so that's often the referral question that I get coming into my office is, behavior change or behavior concern is kind of the referral, or changes in sleep. And then when we sit down and talk, we may be doing an ADHD evaluation, or we may be doing, some level of like managing anxiety, or, starting to uncover that somebody's being bullied, or that there's, something else going on. I think, often, we're kind of seeing, those changes are kind of the concern that the parent has, and then that helps us get to the bottom of that. And yeah, they may not want to talk to their parent, and they may not be ready to share some of that or talk about that. And I would say to parents, that doesn't mean you're doing a bad job, or that like you're failing as a parent, or you're missing anything. It really is, it's hard for kids to process a lot of that. Their emotional development is ongoing. And so they're trying to figure out, like, what am I feeling? What is going on? What is happening? And they may not even be fully understanding kind of what's going on. And so totally okay if you're noticing differences to be reaching out to your pediatrician, or to a therapist, or someone like that, or reaching out to school and school counselor, to say, hey, I have concerns, let's talk about this. And definitely okay, like even if it's only been like over a weekend or something, still okay. Again, Dr. Conley highlighted early, intervention, and early, is great. And so we definitely, find that we can really help prevent a lot, the earlier we're able to intervene.
I think that's a great point that you both touched on. And I think the early intervention is something maybe we should dig in on a little bit more, because we're reading about these types of situations where children have been cyberbullied, or they've been bullied at school, and it's sometimes too late. Can you both talk a little bit more about when that red flag of irritability you're seeing at home, or you're getting a little bit of a situation, of a storyline? What do you do at the school? Who do you go to, and how do you approach this? I think that's a really important topic that parents are worried about today.
I'll let you go first, Dr. Conley.
You sure?
Yeah.
Yeah, so this is something that unfortunately is so prevalent, and it comes up a lot in will checks. We do the PHQ-9, the depression screeners in our kids all 12 and older, and then we usually have the parents step out and do that kind of confidential part of the visit. And time again, this has come up as kind of one of the reasons why kids are feeling sad and withdrawn. And so, when this happens, we always have to make sure that there's no thoughts of wanting to hurt themselves or hurt anybody else. And then once we kind of establish a safe plan, it's getting them resources, trying to connect them to people like Dr. Radcliff, to get them talking to somebody about what's going on, and then to let parents know and get the schools involved to come up with a safety plan at school too. This is something we do not take lightly. When we hear bullying, we have parents, reach out to schools right away. I've had conversations with people at school before too, just to sometimes unfortunately it's most schools are great, but there are some schools we've had issues with where they're not taking it as seriously. And so if we find that's the case, and parents are letting us know that, then we as pediatricians are stepping up and saying, no, this is impacting, their mental health, and it's not a safe learning environment. So same thing, if you have any clue that this is happening, bring them in, talk to your pediatrician about it. And then, Zach, you can say what your part of it is.
Yeah. And I think, I'm really glad you touched on a couple of things, because I think we often hear, so I'm a psychologist embedded in a primary care practice, and we borrow on the pediatrician trust that a family has. The person that they're going to call first is Dr. Conley. And that's the easiest person often to get a hold of. If you don't have a psychologist in your, doctor's office, it can be a little bit, of a wait sometimes to get in with someone. And even, me, it can take a couple weeks to get into, see. And so, I think calling your pediatrician and calling the school are both great options if you're concerned about these things. Those are great places to start. I think the other piece of this, when we've been kind of highlighting prevention, is parents can advocate, right? Think about like what your school is spending money on and how they're allocating resources. Delaware just passed a bill, increasing funding for counselors in schools and increasing support, for the students around social emotional learning, which I know there's plenty of people that aren't fans of that. But the reality is, when we look at the research, it's really effective at preventing bullying. It's really effective at helping kids have improved self-esteem, self-concept, and we see that kids come out of those programs happier, and with less anxiety, less stress, and things like that. And so I think a lot about kind of this prevention piece. But the reality is, stuff still happens, and so getting involved with school, as soon as possible. And usually, most school districts, most schools are going to have administrators in each school that are kind of tasked with managing behavior concerns, bullying, and things like that. And so, if you say the B word, bullying, you're going to hopefully get connected to that right person. As Dr. Conley pointed out, sometimes the schools are dismissive, are not as supportive. And that's where you want to think about potentially getting an advocate involved as well. So we work closely with like the Parent Information Center. So every state has some form of this. In Delaware, it's the Parent Information Center of Delaware, and Pennsylvania. I'm blanking on yours right now, but there's a version of this in every state that is essentially a free resource where they have educational advocates to make sure that kids are getting their needs met, whether that's academically, whether that's emotionally, whatever that might be. They can support you with advocates and people that can really kind of help. And so, a great resource, to look for. And again, Parent Information Center is typically what it's kind of called in most states, but it changes. Every state sometimes has its own flavor for it. But definitely recommend folks, reach out to that if you're struggling to get support through the school or struggling to get your child's needs met, whether that's being, that they're being bullied and it's not being addressed, or whether that's, again, academic concerns or, other things. If those needs aren't being met and the school is not supporting your child appropriately, there's advocates and there's folks out there that can help support. And certainly, they're incredible folks and love working with them.
I think you both raised some important pieces here, and if you put it into the camp atmosphere for ESF, we have a no bully policy. There's schools that have no bully policies. I think right away parents could find out, what is your policy, what is your process, what's your standard operating procedure, and if families don't get a call same day or the next day as a follow-up to see how is your child's day today, are you seeing a little bit more improvement? And if that dialogue is not now fluent happening, that cadence isn't happening now with a particular point of contact, then you're right. You need to get an advocate involved immediately. But I think schools should be up to date on this. And if they're not, that's because it's coming from leadership. So I would highly recommend parents to jump on top of that immediately, whether it be camp, school, whatever it is, because this is the world we're all living in right now. So,
yeah,
Dr. Radcliff,
are powerful.
We're just coming to the conclusion of this. We could keep going, and I think this will probably be a part 2 coming down the road because we have several other questions from parents. But I want to thank you both, Dr. Conley, Dr. Radcliff, for your expertise, your wisdom tonight. It is fantastic. This has been truly a valuable experience for all of us. I would like to recommend for everyone on this webinar to go to the nemours.org and the kidshealth.org websites for additional resources that the great folks at Nemours provides families and people of all ages. They have a wealth of knowledge. It's up to date. It's relevant for parents, and we can't thank you enough for joining us tonight, and we will be sending around this recording to everyone. We wish everyone a great and successful kickoff to the school year. And again, thank you, Dr. Conley and Dr. Radcliff, for your wisdom and support tonight.
Thank you for having us.